As a family doctor, I want women to know that you do not have to simply push through changes that are affecting your daily life. If you are experiencing symptoms like poor sleep, low energy, mood changes, it's worth having a conversation with your doctor. Many women are used to putting the needs of others first and often dismiss their own symptoms as just part of a busy life or getting older. But your health matters. Paying attention to how you feel and speaking up when something is different is an important part of taking care of yourself.
As a cardiologist, I know women don't always present similarly to men when they are having a cardiac event. My one advice to all women today is trust your instincts and advocate for yourself when you feel something is wrong.
It's quite normal for women to experience an increase in anxiety during pregnancy and the postpartum. So much is changing in life, but even positive changes can bring about uncertainty and ultimately anxiety. When anxiety becomes highly distressing and interfering with a woman's day-to-day life, it's important that she communicate this to her healthcare team in order to access effective treatments. Depression is not the only common mental health difficulty that women need to be aware of during pregnancy and the postpartum.
Parenting stress is so common that it is often accepted as just part of the job, yet it has real consequences for women's health. Research shows that chronic stress and sleep loss during the caregiving years can have long-lasting effects on women's mental and physical health. Too often, this goes unrecognized. This support requires systems, policies, and communities that recognize caregiving as central to women's health. When women are supported, children, families, and society benefit too.
Stroke hits women differently. Worldwide, stroke happens in men slightly more than women, but women are more likely to have more severe strokes and live with long-term disability. Women also face unique risks throughout our lives, from birth control and pregnancy to menopause. Yet women make up less than 40% of participants in stroke studies, meaning care decisions may be based on research that doesn't fully represent us. When women are included, everyone benefits with better prevention, treatment, and recovery.
Pregnancy and childbirth should be among the most joyous events for families and communities. Unfortunately, we hear a lot about rising rates of complications during pregnancy, and that can be scary. While it is true that pregnancy complications are on the rise, it is also true that pregnancy and childbirth can still be the safest time in a person's life, thanks to numerous advances in screening, diagnosis, and treatment. One of the most important things you can do is tune out the misinformation that seems to be everywhere, and instead lean on trusted, evidence-based advice. That means turning to professionals like midwives, family doctors, and obstetricians. These are the people who are there to support you, answer your questions, and help make your pregnancy journey as safe and positive as possible for both you and your baby.
Not all periods are normal, especially if they are very heavy, irregular, or if there's bleeding between periods. Any new vaginal bleeding after menopause is a serious red flag sign. It's important to discuss your bleeding patterns with a physician, ask whether you need a gynecologic exam, biopsy, or imaging to rule out endometrial or cervical cancer, and to advocate for care to improve your quality of life and prevent future issues.
Urinary incontinence is incredibly common, impacting 1 out of 3 women across the lifespan. It can be disruptive and distressing. The good news is that urinary incontinence can be treated really effectively with basic care strategies. No medication, no surgery, but needs a slightly more personalized touch than generic pelvic floor exercises. Only 25% of women seek help, and this needs to change. So if you leak when you don't want to, seek out the care you deserve, and this likely will include the help of a pelvic health physiotherapist.
Relationship safety is a health issue. When a partner is controlling or coercive or violent, women often describe feeling trapped, like they're walking on eggshells, or that they're losing confidence and becoming increasingly isolated from their friends and their family. Over time, this loss of freedom and constant stress can affect your mental health, your physical health, and even your daily functioning. If this feels familiar to you, help is available. By By talking to a trusted healthcare professional or using the free private iHeal app, women can access supports and take steps to enhance safety and well-being.
Menopause officially begins 1 year after your last period. This is often between the ages of 45 and 55. The years leading up to menopause are called perimenopause, and this transition can last 4 to 8 years. It often starts when your periods become irregular, sometimes coming earlier or later than usual. During this time, changing hormone levels can cause symptoms like hot flashes, night sweats, poor sleep, mood changes, and brain fog. Many people are surprised by how common these symptoms are. The good news is that we have effective and safe treatments available if menopause symptoms are affecting your daily life. Then talk to your healthcare provider about the options.